Today, the NHS turns 72 years old. I should be at the clock tower in the centre of Leicester protesting, but here I am indoors with a homemade placard, doing something at least, and putting down my thoughts about the state of the NHS and why we need to protest to overcome the cuts that are being made by the Tory government. It's a pity, but safety must come first. The NHS has been supplied with out-of-date protective equipment. The PPE stockpile was managed by a private US company, and vital items, gloves, visors, were left off the stockpile when it was set up in 2009. 200 million pieces of kit, 20 million respirators out of 26 million are now out of date, and they were given to staff. In Leicester, the General Hospital is under threat of closure as an acute hospital. It's crazy to think that cuts are being made to the NHS even in the midst of this global pandemic. We need to fight back. We need to get involved. I am a member of Socialist Alternative, which is part of a broad campaign group called Health Campaigns Together, which brings all organisations fighting to save NHS services under a single umbrella. Socialist Alternative fights to stop cuts to the NHS, to end outsourcing and the tendering of services. We fight to bring the pharmaceutical industry back under public control, and to fight for a genuinely national health service which is there to meet the needs of everyone. This present crisis in particular shows the inadequacies of the capitalist system. Trade unions in particular need to get off their knees and fight for their members. If you're not a member of a trade union, then I would urge you to join one and get involved in your workplace. NHS staff have gone through years of pay cuts and in effect paying for the 2008 financial crisis and the government austerity measures. Only by coming together can we improve working conditions and health and safety in our workplaces. We need to build a mass movement to save our NHS. We now need our NHS more than ever. Tories may clap on a Thursday at 8 o'clock or wear an NHS badge in Parliament, but the NHS logo is all too often a fig leaf for privatisation, used to give private healthcare companies the reassurance that they're actually part of the NHS when really they're being outsourced. Serco, Virgin Health, Boots, Deloitte Touche, Sodexo, KPMG, the list goes on. £9.2 billion of NHS contracts were given out last year to private companies. We want to bring these services back in-house, for the NHS to be run publicly to meet our needs. We want to end the scandalous waste of PFI. We can afford a publicly run NHS. In 1948, when the NHS was first set up, infrastructure had to be rebuilt after the Second World War, and the country at that time was desperately short of resources. In the 21st century, in 2020, we have advanced techniques and resources that they were unheard of in those days. We can afford a national health service to meet our needs. We need to end the inefficiencies of capitalism, the pointless duplication. Healthcare should be democratically planned and controlled to react to crises such as the one we're in. If you think about it, there must be many private companies rushing to be the first to provide a vaccine for the COVID pandemic. Yet all of this needless duplication of work could have been planned if there was a socialist economy in place and if health services were run to meet our needs rather than to make profits. We have won victories. In Leicester, we won a big victory by campaigning to save the Glenfield Children's Heart Unit. And more recently, in Seattle, our comrades in America have won a victory by taxing Amazon in the teeth of opposition from Jeff Bezos, the richest man on the planet. That small victory for working class people in that city needs to be replicated across cities and towns across the world. We need to rise up because we need public health care which is fit for purpose. And this crisis has shown that capitalism cannot provide that. This crisis has shown that the Tories care more about profits than people's lives. Social care too has been privatised, and care homes, once run by local councils, have fallen to the private sector. We've seen callous disregard in that hospital patients were transferred to relieve pressures on hospital wards to care homes, and they spread the COVID virus as a result. This tragic loss of thousands of lives could have been avoided. We need to protect our NHS. We need more resources and more funding. We need to stop the cuts to health services. We need to build the Socialist Alternative internationally. If you're not a member, please consider getting involved. www.socialistalternative.net